Hi, welcome to our lesson on back pain. Back pain is pretty common. Unfortunately, most of us will experience this at some point in our lives. And the incidence does increase with age, so you're not out of the woods yet. So there are a few different reasons this can happen. There can be some degeneration of the spine that can happen over time, maybe related to some other problems like osteoporosis. There could be spinal stenosis, which it happens when there is stricture and pressure on the spinal cord, or it could be just muscular damage, from an injury that causes muscle spasms. So the incidence does increase with age. We'll talk about herniated discs separately, because that can also cause some lower back pain, so I'll talk about that in a second. Obesity is a risk factor, smoking, poor for everything. Poor posture, poor physical condition, which doesn't only mean obese, right? So this could be somebody who's just sitting in a computer every day, all day long. Or poor sleeping condition, some occupational risks too, like people who lift a lot, they're going to be at a higher risk. And actually, CNAs have the highest risk factor for back injuries of any occupation that there is, and that's just because they're constantly lifting people, which are difficult to lift and unpredictable. And then, believe it or not, stress and depression increase inflammation in the body, and sometimes that can localize in the lower back and cause some lower back pain too. So, manifestation would be acute pain and muscle spasms, right? And this can lead to then limited mobility as a result. Different ways we can diagnose this. We're going to do a history and physical, find out if there was some traumatic event that caused this to happen. We can do an EMG, which looks at electrical activity and how the nerves are communicating with each other. X-ray will show us if there's any bone issues. CT scan and MRI also look at bone, but they also show us a little bit about what's going on with soft tissue around it. We can do a bone scan, or we can do a myelogram, which actually looks at the fluid inside of the spinal cord and the nerve roots and tell us if there's any trouble there. So back pain can be really difficult and frustrating to treat because there's a lot of things that we can do, but not a lot of things that really help that much. So the person may be able to do some exercise and strengthen that lower back. That could include physical therapy. They could also use heat and cold therapy, which you learned about back in 170. We may do acupuncture, massage, yoga, meditation. If they are overweight, then losing weight may be helpful. We try to stay away from medication as much as possible, especially opioids. It used to be that was the main treatment for lower back pain, and it really led to a lot of addiction issues. So now if we're going to treat lower back pain with medication, we try to stick with acetaminophen or NSAIDs or some topical creams, maybe muscle relaxants. Opioids are probably going to be the last resort because, there's no long-term fix there. If this is going to be a chronic issue, then we really don't want to create another problem, which is then going to be addiction to opioids. We could also do corticosteroids, which relieve some of the swelling. And then if there are issues with depression, antidepressants may be helpful with this too. Sometimes also benzodiazepines, but again, anything that's addictive, we want to try to stay away from if we can. Worst case scenario, we may need to do some surgical treatment. Interventional therapy is focused directly on that site, so we may put nerve blocks in, may inject steroids or narcotics directly into the source of the problem. Hopefully that will help. We could also do TENS, which is that transcutaneous electrical nerve stimulation, which blocks the signal to the brain that is telling the brain, hey, this is painful. And then lastly, we may just need to do back surgery, and there are a lot of different surgeries that we can do to try to relieve some of that compression. We'll talk about some of them in class, but they aren't always effective. And in fact, there's a medical diagnosis, which it just failed back surgery because we'll do the surgery and it didn't actually help at all. Again, that's very frustrating to this person and can lead to, some depression because it's tough to just be in pain all the time with no relief. So complications besides depression would be impaired mobility and this can really be traumatic for the person. They may not be able to do their work anymore. It can really affect their lifestyle. And then if there's nerve damage, it can lead to impaired bowel or bladder elimination, where they may even become incontinent. So herniated discs are a reason for lower back pain. They're not super common, but the risk does increase with aging. The age risk would be age 30 to 45, and I don't want to say that 45 is super old, but after age 45, the discs inside of the vertebrae begin to dry up a little bit, so there's less risk of them herniating. It's more common also in males, but again, it's only happening to around 2% of the population, so this isn't super common even though we hear about it a lot. So what happens is there's a tear in the outer lining of that disc, and it just herniates. And sometimes some of the fluid that's inside of that disc can leak out. So it causes compression on the nerve root, and that fluid is also very irritating to the nerve and can cause a lot of pain. Risk factors, again, could be a trauma, although that's not very likely. That age of 30 to 45, more common in males. Obesity is a risk factor, smoking, of course, and then any occupation where there's like a lot of heavy lifting can cause that disc to herniate. For CNAs, for example, or nurses. So this is preventable, hopefully. We want to teach good body mechanics, especially if somebody is in one of those occupations. That's why using proper body mechanics when you're working is so important, because I've known unbelievable amount of nurses that have had lower back problems because of poor body mechanics. So definitely always, lifting with the legs and not with the back. Avoid bending at the waist, having good posture, and maintaining good muscle tone. So exercising outside of your work and stretching so that it doesn't lead to problems later on. So the clinical manifestation may be pain, impaired mobility. Sometimes if it's affecting the nerves, there can also be numbness and tingling. I'm going to diagnose a herniated disc through the history and physical. So we'll find out if there was a traumatic event that caused this. Do a neurological exam, especially the lower body, to find out if there's nerve damage. We can do x-rays to look at the bones. So CT scan or MRI will tell us a lot about the soft tissue. And then again, myelogram will show us the internal contents of the spinal cord, so we can see if there's anything leaking out. So treatment would be to avoid whatever position is painful. That's not always possible, right? But if there's a certain position that's painful, avoid that position. We can also do exercise and physical therapy. Medications, again, we try to stick with NSAIDs if possible. Of course, keep in mind all the risk factors with NSAIDs, like the GI upset, risk for GI bleed. And then maybe muscle relaxants, sedatives, nerve pain. Medication, gabapentin is great for that. It's technically a seizure medication, but it helps a lot with nerve pain. And then surgical management is always going to be a last resort, truly because it's not that effective and it can cause other complications. But we may be able to remove that disc completely, put a bone graft in there, which then is going to decrease their mobility. Or maybe they're going to fuse the bone or put rods and pins in there to keep the bone from moving around too much. Again, that's not always effective and can lead to other complications. So we try to treat conservatively as much as possible. We'll talk a lot more about this in class, so make sure you do your reading, and I'll see you there.